Hi everyone. Let me ask you one question first. Do you know in this era why so many of young women is suffering from oily skin problem, acne problem, fertility problem, weight gain problem, and struggle with their menstrual problems, irregularity of menstruation or heavy bleeding? So these all are leads to one medical condition. Nowadays, if you just knock in every door, you can see one of the girl from that family is suffering from PCOS, that is Polycystic Ovary Syndrome. Yes, in today's discussion, we are going to understand this PCOS. Hi, I'm Ankita Sen. Welcome to my channel Nursing Sensation. So first understand what is PCOS. Firstly, it is a problem with the hormones. So this is firstly is a hormonal disorder. So what is happening with this hormone? These disorders are mainly affecting the women in a reproductive age group where the hormones are getting ups and down in various way. So in these conditions, ovaries are produces excessive hormone which is known as androgen. Yes, androgen is the main problem. So this androgen is releasing more, and that can lead to the irregular menstrual bleeding or the irregular ovulation, which can lead to irregular menstrual bleeding or the other complications or the signs and symptoms for PCOS. Firstly, a small cyst can appear in the ovary, which may not be cause of sign and symptom, but nowadays, the research is saying a small cyst in the ovary can show sign and symptom for the young ladies. Okay, so this is the most common of infertility in women. So timely diagnosed and management is most important for PCOS. Let's understand what are the sign and symptom of PCOS. I know many of girls like you are suffering from this problem. You know very well, more than me, what are the signs and symptoms you are experiencing every day or every month. So first thing is the menstrual problem or rather irregular or the missed period. So what we can see is that there's an irregularity in the menstrual bleeding, sometimes happen in every month, sometimes not happening in a second or third or fourth month even. So oligomenorrhea can happen, amenorrhea can happen, or heavy bleeding can also happen. Along with that, there is an irregularity of the cycle of the menstruations. Okay, so first. Secondly, there is an excessive facial of the body hair, which is known as a hirsutism. Next is acne or the oily skin. So this acne, what I have found around me, the girls are suffering a lot with this acne. Then excessive weight gain without any reason. They are saying everything is okay, but I'm gaining my weight like anything. So excessive weight gain, which is especially around the belly or the abdomen, the women are increasing their obesity. Then difficulty in conceive, because see there is an irregular ovulation. So as there is an irregular ovulation, as the excessive secretions of an androgen hormone, so there is a chances of having this infertility or problem in the difficulty of conceive is more. Then there is a dark and velvety skin patches some women are having in their back. So these are the common signs and symptoms we can see. Now come to the most important. Maybe you can relate that. That is the cause or the risk factors for PCOS. So what are the risk factors for PCOS? The main problem, you know what? There is no exact known cause of PCOS. That's the most important problem first. But if it is linked to the any cause or risk factor, that we can do. That is first of one is insulin resistance. So there is a problem with this hormone, that is insulin. I have told you this is a hormonal disbalance. Okay, so the body does not use the insulin sufficiently. So if the body is not use the insulin effectively, so what will happen? That can leads to high in insulin level, definitely. So body is having excessive insulin, which triggers the ovary to produce more and more and more androgen, and this more and more and more androgen leads to problem in the ovulation. So that can lead to the problems. Next come to the other hormonal disbalance or the imbalance, that is higher level of androgen, which is a generally a male hormone. There is a problem in the androgen. disrupted balance between the LH, that is luteinizing hormone, and FSH, that is follicular stimulating hormone, leading to irregular ovulation. Sometimes genetic predisposing factors, so it comes genetically or hereditary. So this is not modifiable factor. Okay, so if the girls are getting this disorder genetically or hereditarily, so this is not a modifiable factor, but by the lifestyle changes, by the dietary management, she can have the less signs and symptoms and the less complications, definitely. So the exact cause is unknown, but there is some link factor like insulin resistance, then there is a hormonal disbalance of the higher androgen, problem in the LH and the FSH hormones, okay, and there is a problem in the genetic disposer or the predisposing factors also. But these can leads to, I mean, the PCOD can leads to, or PCOS can leads to some more complications further for the woman, like type 2 diabetic mellitus, heart disease, that I will discuss as a complications. Now come to the diagnosis, how you can understand that the women are suffering from the PCOS. So how can we can diagnose that? So there is Rothendam criteria. Here there are three criteria. Among these three criteria, if any two also present, we can diagnose as a positive PCOS. How? So first criteria is irregular or missed ovulation or the period, first criteria. Second is clinical or biochemical signs of excessive androgen. I mean clinically means more hairs on face and whole body, okay? Or biochemical, I mean by checking the male hormone, that is androgen, okay? By checking in the lab test. Third one is polycystic ovaries on ultrasound. So in the ultrasound, if we see there is a more than 12 or more than 12 cysts are present, or the ovarian size or the volume is getting increased, so this can be a indication. So Rothendam criteria is saying that among these three, if any two is also present, it is diagnosed as PCOS. Now other test mean the hormonal test. What I have said, there is a problem in the androgen, LH, FSH. So these are the common hormones. So we have to go for the lab test for androgen, LH, FSH, testosterone, then prolactin, insulin, thyroid stimulating hormone, etc., etc. So these are the other causes to correlate the factors and understand that the woman is suffering with the PCOS or not. Now, come to the complications of PCOS. So, what are the complications that may arrive? I have already given you some hint that the woman can suffer from, in a long term, type 2 diabetic mellitus, yes, or sometimes gestational diabetes mellitus, okay? There may be chance of high blood sugar or high cholesterol that can lead to high risk of heart problems, okay? Then endometrial hyperplasia can occur, or this due to these hormonal changes, this cancer can be occur, okay? So due to the prolonged unopposed estrogen, this can lead to this endometrial hyperplasia or the cancer. Then the woman can suffer from sleep apnea. Very common, very, very common, sleep apnea. The woman can suffer from depression, anxiety, that why I am having this much of weight gain suddenly. So the body image issue can come. Okay, these are the complications. The woman may having the depression, anxiety, because why I am having this much of acne, why I am having hair problems, why I am having more and more hairs on my face, and like males, this is disturbing my body image and my facial image as a female. So these are the cause of depression and anxiety. So these are the complications may arise. Now come to the most important and most exciting part, that is the management. So how you can manage the PCOS, maintain the healthy weight with a regular exercise. This is the only one first thing that you have to do by your own, or you're counseling someone, so you have to counsel for this point first. If we're going to any doctor, the doctor will give you the medication later on, and the doctor will suggest for first the lifestyle modification and the weight weight reduction therapies, okay, like exercise and yoga and dietary management. So this is one. Secondly, eat a balanced diet rich in whole grains, fruits and vegetables. What I mean to say is that high fiber foods like the vegetables, fruits and the whole grains, okay? we can take the lean proteins, which is very helpful. We have to limit the refined carbs and the sugar. Total limitation in the refined carbs and sugar. Okay, exercise as at least 150 minutes per week, okay, of moderate activity you have to do, or in a daily basis some freehand exercise, some body warming the woman can do to reduce her weight and to reduce her anxiety, depression as a diversional therapy too. Okay, so these are the things she can do. Manage the stress with the yoga and meditation. I am always recommending my students who are suffering from PCOS, please do yoga or meditation after your clinical hours or after your study time, because a 10 minutes meditation per day or a 10 minutes yoga or concentration per day will increase not only your hormonal levels, and also it will balance everything in your life, everything, your other life stress problem also managed by this yoga and meditation. Okay, that will not only leads to the problems along with the the treatment of the PCOS or the prevention of the complications of PCOS, it will wholly reform your body. That is yoga and meditation. So please try to do it. Okay. Then doctor may prescribe you some birth control pills. Okay, that is due to regulate your periods. Okay, or they can give some medications to reduce the insulin resistance or to assist the fertility. If someone is suffering from infertility, so by the treatment of infertility, the doctors can prescribe some medications as per their choice and as per the situation or the condition of the woman. Okay, so these are the management we can do. The mostly what I'm going to focus is diet. Plan your diet: low carbs, high protein, no refined sugar, no refined carbs. Totally stop. Try to take homely made normal food which is less spicy. Okay, and you have to cut down all the hard drinks and the cold drinks. Totally you have to cut down the smoking and the alcoholism. So these are lead to weight gain, and these are leads to sometimes addiction, which can again leads to sleep apnea, depression, anxiety when you are not going to get them. So to reduce all that, you need to modify your lifestyle first. Okay, so these are the management and the lifestyle changes that you can do. If you want to diet chart for the PCOS, let me know in the comment section. Definitely I'll help you out, because I have helped my so many of students by giving or provide them a proper diet chart, and they are very well by maintaining that diet chart along with the yoga and the meditation after their clinical practice or the educational job. Now talk about the nurse's role in PCOS. So what you can do, you can educate the woman or inform the woman for the healthy lifestyle choice. You can counsel her to adopt the healthy lifestyle choice. I know it's not easy to, but you have to counsel. Next, you have to provide counseling to reduce the stigma and the anxiety. It's not anything that you can't discuss about PCOS in front of everyone. So this stigma has to be removed. Okay. Then encourage the regular checkups for long-term health monitoring, because we know that type 2 diabetic mellitus and the health problems, the heart problem that can arise later on. So continuously long-term healthy monitoring is important. And counsel the woman, then don't stop any medications by your own. Ask your doctor and then you can stop. Support the woman with fertility concern. Next one is promote the awareness programs in school and the communities. This is very important, because most of the teenager girls or the adolescent girls are suffering from this problem right now, what it is. Now, if I just spreading the awareness program in school and communities, that a girl will not land up in her pregnancy with the infertility. In her pregnancy reproductive age, she will not land up with her pregnancy problem or the infertility. Okay, so what I can say in last, that PCOS is very common, but trust me, it is manageable. It is totally manageable. So early diagnosis, lifestyle changes, and proper treatment can prevent complications and improve the quality of life. So let's spread awareness so that women don't ignore their symptoms and they will seek help on time. So maybe you are the one who is firstly going to spread this awareness by sharing this information to your friends or by sharing this video with your friends. If you find this is a very practical and helpful video for you, Please don't forget to like and subscribe my channel and hit the bell icon so that you will never miss any notification from my video. Till then, stay healthy, stay blessed.